Welcome to the College of Medicine in Tucson and the Medical Student Research Program. I'm Dr. Marlys Witte, Professor of Surgery, Neurosurgery, and Pediatrics, and the founding director of what we call MSRP. Since the earliest days of the medical school, student research has been a highlight that has been popular and influential in the course of the medical student's education and their career. And in 1982, we organized it into a formal program that was funded by the National Institutes of Health, and it has since been funded continuously to the present day. The Medical Student Research Program has a number of components. One of them is the Summer Institute on Medical Ignorance, which is its centerpiece. It's the introduction to research here at the University of Arizona College of Medicine. And for 2 full months, students conduct research of their own choosing in the basic sciences or in the clinics. And they do full-time research in the laboratory or in other settings. In addition, they do ignorance logs every day to chronicle their unanswered questions, which guide them through their research and the rest of the summer full-time experience. In addition, we have seminars from visiting professors, including alumni of our program, many of whom have gone on to distinguished careers in academic medicine and also leadership in private practice. At the end of the summer, all students do a PowerPoint presentation. Some of them make videos as well. And they submit a report that's framed by their beginning and ending questions. Curiosity and ignorance are the theme, and ignorance is all the things we know we don't know we don't know, and think we know but don't. And they're not part of the usual medical school curriculum. After SIMI is over and students have started their research with their mentor, they may want to continue it through an option called the Research Distinction Track. This is technically a senior course, but students can begin it very early as soon as they reach a more advanced stage in their research. So when they finish the summer, they can continue their project through the senior year, receive 6 units of credit, fulfill a number of requirements, and often, and usually, actually, we expect that they will have a number of publications and conference presentations that may occur locally, nationally, and even internationally. Some of these experiences and research are not on campus here, but they're in other institutions around the country. And also we've had students go for international experiences to the Pasteur Institute, to India, to Peru, to Buenos Aires, to continue their advanced research there. Many of the students have commented that as they go for their residency interviews, particularly in the very competitive specialties, the interview is taken up almost entirely talking about their research and even having discussions about the topics that they've encountered. So we hope that you will consider the Medical Student Research Program, and particularly start it off with the Summer Institute on Medical Ignorance, and then continue it through the Research Distinction Track. Over 1,000 students have participated already from the University of Arizona, and some of them are our most distinguished visiting professors, several of them very active internationally in the COVID-19 pandemic research that's ongoing. This coming year, you all will be choosing a scholarly research project that will be required, and we hope that many of you, many more than even now, will choose to do research with our program. Our Medical Student Research Committee is anxious to encourage you to review your proposals and make sure that they fit in with the career trajectory that you have in mind. Thank you for your attention, and now our program staff will answer your questions, and we will always be there when you need advice, letters, and anything else.